and welcome to all our listeners to an exciting episode of the Medgate Today Podcast, where we bring you the most insightful conversations from business perspective in the world of healthcare, pharmaceuticals, diagnostics, and medical device advancements. Today, we are diving into a fascinating discussion about pharmaceutical, cosmetic products, and herbal products industries that are rapidly evolving and reshaping healthcare and wellness across the globe. We have a very special guest with us who is an expert in this field and having an experience of more than 3 decades. Please join me in welcoming Mr. Ishar Alam. Hello, sir, and welcome to Medgate Today Podcast.
Thanks a lot to inviting to us to brief the matter. We are grateful for the same. Thank you.
Sir, as you have more than 3 decades of experience in this industry, so we would like to know about your journey in this industry and what type of things you cater.
It is very simple. Basically, I am an approved manufacturing chemist from the Government of India in all these categories for medicines, etc. And having experience of more than 35 years in the same field.
Great.
In the manufacturing as well as export in the East and West Africa particularly. In East Africa, we are there since more than 33 years and are providing quality products in the pharmaceutical, herbal medicines, and the surgical, etc.
Okay.
Basically, India is a leader in these 3 fields, and myself is expert for all these 3.
Okay.
In the African belt, the concerned companies, they give a nice respect to us that Dr. Alam provide this and that medicine to us. We are the best. We have replaced China in the African market, and India is a leader, undisputed leader in this field.
Well said.
I would like to brief something to you that Indian products, they are complying with the SA, that is a basic nucleus, the functional group in the medicines, whereas the Chinese, they don't have. That's why we have the efficacy in our medicines. They affect. If you take 1 tablespoon of this cough syrup, it will give a relief to you. In case of Chinese, you get 1 bottle, but you will not get a relief. Since they don't have a parameter for that. We are manufacturing these medicines in India as per the GMP norms and at the WHO.
Okay.
Even the African belt, which are supposed to be the poor countries, they are following the WHO parameters, and thanks God we are complying for that.
So you hold 2 companies also, so we would like to know about your companies.
My company, we have started this company in 1992 as a consultancy company. We provide the complete turnkey projects in the manufacturing of pharmaceuticals. We have provided these consultancy services at Mumbai, Ankleshwar, Bhiwadi, Lucknow, etc.
Okay.
For the complete plant of the bulk drugs as well as the pharmaceuticals. So this journey started from the 1992. In this company, Al-Azhar Technocrat Private Limited, we are providing technology. In my other sister concern, Al-Azhar Technologies Private Limited, we are providing complete manufacturing as well as export to the African belt.
Okay.
Particularly in the East Africa, we are in Tanzania, Ethiopia, and Mozambique.
How many countries do you cover, sir?
At the moment, we are covering around 5 to 6 countries.
Wow, that's great, sir.
In the East Africa, we are there. In the West, we are in the Ghana, very wonderful country, and Senegal, and some part of the Nigeria,
Very
like
nice,
in Lagos.
sir. Very nice.
We were there in those countries in West where no Indian was there in this field particularly.
Okay.
Like one country was there, Togo, in the in the West Africa. It is a very small country having population of more than like 2 million only. But we have provided quality medicines to them, and they like India very much.
Yes.
All African countries, they have plus point with them that wherever I visited, they always give a very warm welcome to us, being an Indian.
Very nice, sir. Very nice. And it's nice to hear this.
Yeah. And we are happy that our country is getting such a top priority in all these things.
Sir, as you said, you do the export.
Yeah.
So how government is helping you? What kind of ease you are getting from government side also?
Government is always cooperative, but we don't need in our case.
Okay.
Since we are manufacturing and exporting directly.
Okay.
We don't require any funding, etc. But government is quite sympathetic in this regard. They provide quite good data also whenever we require. Sometimes we also provide to them.
Wow.
We provide the data even to the Western countries also, like USA. We have provided.
So win-win situation from both the sides.
Yeah. We have provided even these data to the USA also.
Oh,
We're supposed to most developed.
That's great.
So thanks God. Technically, India is number one in the manufacturing of the healthcare, like pharmaceuticals, herbal medicines, herbal cosmetic. In this segment, baby care products also, beauty care products,
cosmetic
skin care products, and beauty care products. India is rising in this one.
Yeah.
In the pharmaceuticals, we have a quite good range for this tablet, capsule, syrup, injectable, dry syrup, IV, etc., which are the quality mark. Yes.
So, as you are in this industry for more than 3 decades, so what kind of evolution you are seeing in the African market, and how you are strategizing yourself to cater the African market?
Maria, that is very easy and very simple. All the African countries, they have their own parameter for the registration of their product as per their FDA norms. Every country where you want to export these medicines, you have to register with the FDA there, concerned FDA there. They provide a registration number, and after complete analysis of the product, when they found that these parameters are okay as per laid down norm by the FDA there, then they provide the registration certificate. We write the number on the board, like cup syrup.
Yeah.
So we write the number on that cup syrup, that Tanzania registration number, this one. Then there is an open market for us. We are a king in this regard.
Wow.
And so far as products are concerned, there is a long list for that, but mainly the cough syrup, liver tonic, and this diabetic products, antihypertensive, they are very popular there for our parts. And truly speaking, African market is a untapped market for at least, in my opinion, for 15-20 years. We can do very good business, provided we have to maintain the quality and our commitments.
Sir, in Africa, WHO is very active. So, do you have any kind of tie-up, or you can say any collaboration with WHO to cater the African citizens and market?
WHO provide the data and the parameters to the African countries that they should comply this one.
Okay.
Nowadays, in India, we have a medicines having more combination, 2, 3, 4, 5, 6.
Yeah.
In Africa, as per the latest WHO norm, we can sell only single molecule, not 2 molecules at one time. You have to purchase 2 different. If you are suffering from fever or pain, etc., allergic condition are there, then you have to take paracetamol separately and the acetylcholic separately. You will not combination there. Most of the African now they like this combination, as are prevailing in the Europe also. My dear, it is our plus point that there is no competitor. India is a pharmaceutical leader in the world.
Yeah.
Indian companies, they are supplying their products even to USA, which is supposed to be the industrialized and the highly developed country. In the Europe, France, Germany, Italy, Spain, they are also importing Indian raw material also. Sometimes finished also. We have to be there for a longer time.
Yes, as you said that we don't compromise with the quality. So we all know that skincare things or safety comes on top, and it's the most concerned thing. So how safe are your products, and what kind of age group you cater it, and what type of products you make?
All the Indian pharmaceutical products, that is a finished formulation, they are made from the day one of the child up to the 9th year and plus 9th year of age.
Very nice.
Having almost no side effects and after effects.
Very nice to hear this. So what's the future plan for this?
Very nice, very appropriate. We have to try ourselves, we have to be involved from the basic root. We have to be there. The African countries, the buyer, the entrepreneur, they like those companies which have their presence there, so that they can get instant data, instant treatment, and instant requirement.
Yeah.
Simply to phone, fax, or email, that doesn't work. If you stay there, you ask the concerned parties, they give priority to the Indians.
Yeah.
That's the thing. Rather than the West, all these French companies, British, Italian, Swedish, etc., German, etc., they have around 500 times more prices than ours. Whether our quality is the same,
Yes.
our efficacy is more better.
Yeah.
If it is there in those things, then the product will affect adversely. We have to maintain like this cup syrup, gripe water, liver tonic. They should be free from these heavy metals. As per the limit of the WHO, it should be not more than 10 ppm.
Okay.
But in most of the Indian products, which I saw also, they have 400, 500, 600, sometimes they have 800 ppm. You just compare, where is a 10, where is 800? That's the thing.
True, yes.
If we comply that, we are a leader in the herbal. So most of the Indian companies, they should follow this thing. I have applied for these products in the African market on behalf of some other companies. When the parameter was this one, we were winner, we succeed.
So you have a lot of segments, like a lot of things, cosmetic, then herbal things. So what is the most demanded product?
The pharma is always demanded. As you are taking food, you have to take the medicine as well. It is an essential part of the life. Until unless the human beings are in the earth, they have to take the medicine.
Yeah.
That's the thing. And as per the time passing on, this demand is also going on. See, new disease, new parameters, new testing procedure, new technologies are there. So pharma is a base.
Yes.
So far as the cosmetic concerned, that is the demand of the body. For 28 days, 25, you do not need to maintain anything else in your body.
Yeah.
But after 30, body also requirement.
Yes.
They require this thing.
They also need
the skin
something.
require that it should be hydrated.
Yeah.
And the hair, they should also get the nourishment for those things.
Yeah.
So is the beauty.
Yeah.
So it comes around after 25, it has to be maintained. It is for the satisfaction, and particularly for the women. They have to maintain themselves to keep in the market, to keep in the society.
Yes, well said, sir. So my last question to you would be, what kind of advice would you like to give to the entrepreneurs in India to go to Africa and have a successful business over there?
That is a very right question. That is, as I told earlier, they are the untapped market. Indians have to trap one, they have to try one to penetrate that market with their quality products. And in this case, we providing the consultancy services for those things. Those who are interested to enter that segment, like in the pharmaceutical, surgical disposable, medical goods, medical instrument, equipment, related industry, we are there to serve to them so that they can get a entry at the earliest stage. Since we know the Africa from the ground level, we know them very well. They are very cooperative, very sincere, and moreover, they like Indians very much. That's a basic thing. You have to approach them in a proper way.
Fantastic and fascinating conversation with you.
Thanks a lot that you have given to us the opportunity to brief about this thing. I am very thankful to particularly Mr. Afzal, who is the editor-in-chief of this one. He has managed a very good show to us.
Yes.
And we are thankful to you as well.
Thank you so much, sir.
To devote this time to us.
Yes, and it was great knowing all about the African regions, their love for us, and the products you are making for them and for our own country, and how you are getting the respect and how you are thinking to change the future of pharmaceutical or any other product for the betterment. It was great.
Actually, in the African bed, the rising tendency is this one, that most of the Africans, they interested for the to get the manufacturing facility in their own country.
Yes. Thank you so much, sir, for coming here and giving the insights.
Thanks also.
To all our listeners, thank you for tuning in. If you enjoyed this conversation, don't forget to like, share, and subscribe to Medgate Today Podcast. Stay tuned for more insightful discussion with the industry leaders. Until next time, stay safe, stay informed, and keep innovating. Thank you.